All right, so chapter 21 is about careers in dental public health. Learning objectives for this chapter will be to be able to define dental public health careers, identify various governmental careers in dental public health, and define dental hygiene positions in a variety of settings. So after studying this chapter and participating in the course, the hygienist student should be able to be competent to do the following: promote the values of the dental hygiene profession through service-based activities, positive community affiliations, and active involvement in local organizations. Promote positive values of overall health and wellness to the public and organizations within and outside the profession. Provide screening, referral, and educational services that allow patients to access the resources of the healthcare system, provide community oral health services in a variety of settings, facilitate patient access to oral health services by influencing individuals or organizations for the provision of oral health care. Advocate for effective oral health for underserved populations, pursue career opportunities within healthcare, industry, education, research, and other roles as they evolve for the dental hygienist. Okay, so introduction. The dental hygiene professional roles. This starts on 295 in your book. Um, it just basically goes into that there are alternative careers. Public health has a lot of alternative career options for a dental hygienist because we are essentially public health. Even when we work in private practice, we are still technically a part of public health because by helping the individual, it helps the community, it helps the overall. So don't think that just because you're not working in a community clinic, or a sliding fee sort of community clinic, you're not working in public health. You still are. Even when you're working in private practice and only seeing patients who have insurance, you are still helping the overall public health. Anyway, so an important characteristic of most dental hygienists who work in public health is an advanced education level. Um, the reason for this is that as you enter into public health, specifically alternative careers, there is more emphasis on having those additional skills and having additional knowledge that you need for those roles. Typically, you need to have some leadership skills that go along with that. When you're working in public health careers, you're typically working with a community or a certain type of public that is underserved in some way. And so people who represent a certain special population and cannot advocate for themselves, or people in a community who have a need that's not being met. So a hygienist who's working in public health should be able to think and work outside traditional parameters to be able to address the needs of that population. And so when we say public health, we're referring to alternative practice sort of settings that are outside that traditional private practice sort of settings. And so by saying public health, I am typically referring to community-based clinics, school-based clinics. There are some like ministry-based clinics, any type of long-term care facility, or acute care hospital or clinic, a cancer center, or even a mobile van. And while here in Texas, a lot of these alternative careers are not available to us here, if you were to move to another state, there are certain alternative careers that would become available to you once licensed in that state. And so I want you to be aware that these exist because you may one day find that you do desperately want to give back and serve in this way. And I want you to be able to understand what that means for you, how you can get into something like that, and how I want you to be able to accurately evaluate whether or not that would be something that you would find fulfilling. um, so here we go. Okay, so federal public health careers, dental hygienists are eligible to practice in public health with an entry level degree. That means an associate's. Any entry level associates or bachelors is eligible to practice in public health. However, I know on Friday, because it's not yesterday, is you're not going to hear this. You're going to hear it on Monday. Anyway, on Friday, Lieutenant Commander Chica came and talked to us about working in the U.S. Public Health Services Commission Corps, right? That is a uniform service, right? And she mentioned that you had to have a bachelor's degree in order to be eligible for it because everyone there is a commissioned officer. And in order to become a commissioned officer, for those of you who aren't aware, you have to have a bachelor's degree. It's in every uniformed service. You have to have a bachelor's degree in order to become an officer, in order to become commissioned, right? Um, However, that doesn't necessarily mean you need a bachelor's degree in order to practice in any public health. That's just the PHS Commission Core. So there are a couple of other ways you could work in public health that you don't go into the Commission Core. So what you could do is contract with the Navy in order to provide clinical and educational services to military personnel on a military dental clinic. This is you could contract with the Navy or you could contract with other branches as well. Here, we have the Air Force and the Army. Um, um, Mr. Huerta works with, I want to say, the Army. So if you guys are interested in working in public health in that aspect, Mr. Huerta might be a wonderful resource for you because he's technically a civilian, but he's contracted with the service there. This is all on page 295 in your book, by the way. Um, you could work with the National Institutes of Dental and Craniofacial Research as a researcher on a study on the relationship of periodontal disease to systemic conditions and diseases. That's just an example of something that you could do research with. But the National Institutes of Dental and Craniofacial Research are always looking for professionals. Now, this is one you'd probably have to get a master's degree or even consider getting a PhD for. You could hold an administrative position within the CDC because of our background in science. That is something that you could always look into, and you have a unique perspective because you obviously are more of a preventative um, person. Anyway, or you could initiate dental hygiene services as an entrepreneur. So there are Concord students, in fact, who have started working in private practice, and they found that there's some type of thing that they'd like to make. They see an idea. They see a need, fill a need. If you, I don't know if you guys have ever seen iRobots, but you basically they've made something or they're selling something or they're doing something in an entrepreneurial sort of status with them. Um, but not all of these are things. If you worked in a community-based clinic, you don't need a bachelor's degree. Working on a school location, typically you're working with a group, so it depends on who all applied for the position, right? So as an associate, you might not have a cutting edge on someone, but you might end up having more experience than someone who has a bachelor's degree, and you might get the position anyway. I know I've gone toe to toe with people who don't have master's degrees; they have bachelor's degrees, but they got the position because they have more experience than me. So it really doesn't always come down to what degree you have or I've gotten positions over people who have more experience because just of who I am. So it all comes down to other factors too besides just the letters behind your name. So a school-based location is possible. Long-term care facility. Now this is something we don't do in Texas because we can't technically work for like a nursing home, but you could contract or you could work for a dentist who contracts in that way and go to nursing homes in here in Texas. So that kind of thing does exist. You really just have to look for it because most of the hygienists who are working in those positions, I know we talked about there's typically a little lower of a pay scale for hygienists working in public health, but it's because there's more of a return for them. Um, you might be willing to take a slight pay cut in order to feel fulfilled at the end of the day, in order to sleep knowing that you've made a difference in the world, and that might be worth the money for you. So it really just depends on you and what you want and how you feel. But don't think that you absolutely have to go get a bachelor's degree, or even that you'd have to get a bachelor's degree in dental hygiene. You could get it in something else, or um, I just want you to be aware that there are still options out there for you in alternative careers um, without the bachelor's. Anyway, moving on. So if you turn the page to this box, this is box 21-1. This goes over the Health and Human Services, has the Office of Public Health as kind of a side branch, and then they still overlook the Indian Health Services, the National Institutes of Health, the Centers for Disease and Control and Prevention, the Health Resources and Service Administration, the FDA, Food and Drug Administration, the Agency for Healthcare Research and Quality, the Substance Abuse and Mental Health Services Administration, the Agency for Toxic Substance and Disease Registration, Administration for Children and Families, Centers for Medicare and Medicaid Services, and Administration for Community Living. So the mission for the U.S. Public Health Service Commission Corps, that is that uh, branch, basically, the uniformed service, who there's 6,000 commissioned officers that work there, and they're led by the Surgeon General. And one of those 6,000 officers is Lieutenant Commander Chica. And so the mission for them is the rapid and effective response to public health needs, which is why she worked on COVID, because that's our highest need right now, right? Leadership and excellency in public health practices and advancement of public health science. So while I know that we talk a lot about how there's a slight pay cut for getting into public health, if you were to go into the U.S. Public Health Service Commissioned Corps, you would be paid based on time in rank, time in service, or time in grade, time in service. And so there's a structure, there's a pay scale for how long you've been in service and how long you've been at your current like position sort of thing. But there's room for promotion. So while you might make maybe like a couple bucks less, I don't know about you guys, but the benefits that are in the service are extremely worth it. Um, there's just so much there. Now, you don't get tax-free money. Like you have to pay taxes, but you don't have to pay taxes on extra things like your cost of living allowance, which is it's called COLA. You don't have to pay taxes on that adjustment. You don't have to pay taxes on your housing allowance based on where you live. You get a certain amount of money. So they give you more money if you live in expensive areas because they make you move, right? They're not going to send you somewhere and then not pay you enough to live there kind of thing. But your base pay is still taxable income. You still have to pay taxes. Anyway, you get all kinds of benefits. There's travel allowances. There's you get 30 days paid vacation every year. You'll never find anywhere else where you get 30 days paid vacation. That's a month every year that you get to take off work paid. You're not going to find that anywhere else. I mean, nowhere. So the benefits of being commissioned, well, I mean, I don't even know about being commissioned. She talked about that. But the money actually ends up being much higher the further into the career you get. So, maybe for like the first 3 years, you're making what a clinical hygienist would make. But then for the rest of your career, you're making significantly more. I know a hygienist who she's also used to be in the Marine Corps, and she's working for the State Department in the prison system, and she is working on her commission. Like it's a process to get hired in a thing like this. And she has her bachelor's degree. She's already working. She's got time in service tons of that. And she's working on that. And she told me based on her time in service, that she was going to make, like, I think she said like 85,000 a year, once she got her commission. So, while yes, we might think of public health being less money, um, it's certainly more money if you stay in it. Um, at least as far as this goes. Anyway, moving on. U.S. Public Health Commission's career. So she talked about this. It's a major division of the Department of Health and Human Services. It provides highly trained and mobile health professionals who carry out programs to promote the health of the nation, understand and prevent disease and injury, and assure safe and effective drugs. Um, I mean, their thing is that they might not go to deployments like in a war zone, but their deployments do take them and expose them to certain things like COVID or Ebola or things like that. Now, granted, as a hygienist, you might not be exposed to quite all of these things, but you might be deployed to areas that are underserved, other parts of the US or even other parts of the world that are underserved that, for whatever reason, we need to provide medical services to. And you would be doing those kinds of things. She also talked about going on mission trips. That's not something that you would have to join the service, the PHS, in order to be able to do. You can go on mission trips as a civilian hygienist. You just have to, take off 2 weeks of work. And then it also provides the opportunity to move up the career ladder. So that to me is probably one of the biggest things, that you would that would be the biggest draw, is to have room for advancement. So government agencies employing dental health professionals. I already read a lot of these to you. This is in that same box that you saw on page 296. I already read these to you, but the Department of Justice also includes the Bureau of Prisons. This is a federal Bureau of Prisons, so it's a little bit different. If you were to work for the State Department, you would be paid through the state. You still get benefits, which is really nice, but you would be working for the state. And then also, I think we'll probably talk about it a little later too, but they have contractors where they hire a company who hires hygienists. And so you don't work for the state, you work for the contracting company, and you go and get paid, and that's how it works. It just depends on their need and how they're going about filling the need. Department of Defense, working on military bases. This is probably the thing I think would be the coolest, because there's 2 bases here in San Antonio. People who are, you know, active duty are the ones that you would be seeing. Um, so, I mean, if you're, single woman, that would be fun. I mean, you could meet a lot of young guys. Those are mostly the people who are in the service. Um, and then the Department of Veterans Affairs, working at the VA hospital. Now, when you work at the VA hospital, you're seeing veterans who are 100% disabled. You're not seeing any type of veteran. So only the ones who have reached 100% disability, according to the VA's rules, are eligible for dental services. So there's that factor there. Okay, so PHS officers include hygienists. You have to be a U.S. citizen. You have to be under 44 years of age. You have to meet medical requirements, and you have to pass an initial suitability test. The suitability test is usually like, are you physically capable of being in the service? If you, it's just like any other branch of service. You have to be, physically capable. So you have to learn, in order to be a PHS officer, you have to earn a bachelor's degree from an accredited program. You have to have qualifying experience for appointment to a particular area. So employment, research, further training in dental hygiene, teaching at a college or university level, or relevant graduate and or research. So if you're appointed, even as a hygienist, you're going to be appointed or basically assigned a position in one of these types of fields. Okay, so you can apply to go work for the U.S. Civil Service. These guys are the people who hire civilian contractors, basically. You're a civilian, but you work for the government. Um, it composes of all appointed positions in the executive, judicial, and legislative branches of the federal government. Not the you're not joining the military if you do this. You stay a civilian. Opportunities in the civil service in many government agencies and opportunities for hygienists. These include working in a federal prison, working at a VA hospital, or working on a military base. In order to get a job with the U.S. Civil Service, you would go to USA Jobs. Um, I'll let you know they change their password like all the time. I've applied to several times. Like I go look, I am always looking. I don't know. I just always I want to see what's out there. So there's been several times, in the my career where I went to USA Jobs and I, applied and I looked to see if there were any positions here in San Antonio because I don't want to move anymore. And there just weren't any at the time that I always looked. Um, I will tell you that they prefer a bachelor's degree for working for the VA at the VA hospital, which is the place that I always kind of wanted to go. I think working on a military base would be fun, but I think you'd be giving people information and it kind of be like falling on deaf ears because they're young, they think that nothing bad's ever going to happen to them kind of thing. I mean, not all of them, but I mean, when I was in the military, I always thought nothing bad was going to happen to me and that flossing was, for losers. But anyway, um, federal prisons, I think would be really cool to go and work there, but it was never available. And so I was always kind of looking for VA hospitals because I like veterans. Um, but it just never happened for me. But every time I'd go, they make me change my password, and it's always like a really complicated password. So just stand by for that if you're interested. But USA Jobs, that's where you go. Here, let me write it down. USA Jobs. Dot gov. Okay. Application requirements. So they post vacancies that are announced on their website with additional requirements. You have to send them your current resume, and you have to send them transcripts, licenses, and certificates in order to like be eligible to apply for positions. So you'll need all of that information there. First, they review the material. The highest ranking candidates are referred to a supervisor or selecting official. Those who are employed are given secret service clearances. You do have to have a secret clearance in order to be able to work on the base as a civilian. So if you have a criminal history sort of past and you're not eligible for secret clearance, then I wouldn't bother applying. If you have employee benefits, I'm sorry, the employee benefits include health and life insurance, a retirement plan, and a long-term disability insurance. The benefits of working on the base, um, they're fantastic. There's more job security there than anywhere else in the world. So, as far as from what I've heard, civilian contractors, they always talk about the benefits. U.S. civil service positions include National Health Service Corps, VA hospital dental hygiene careers, military, and federal prisons. We already talked about that. You could work as an independent contractor. So, again, there are dental staffing agencies that they employ, and then the staffing agency finds you. So, your paycheck comes from the staffing agency, not the U.S. Civil Service. There are certain cases where dental public health, like students, go and work on the base. That's a contract that they have over at UT. So that's between them and UT. Concord doesn't do that because we have our own live clinic where we meet all of your requirements. So, I mean, I don't necessarily think it's terrible that you're not going to work at the VA. But I think it would have been cool. But anyway, there are state opportunities and there are international opportunities as well. So if you wanted to move or you wanted to, go travel the world and clean other people's teeth somewhere else, you could. So next we have the National Health Service Corps, which is a part of the Health Resources and Service Administration, which is also kind of a part of the Public Health Service. It's committed to improving health in the nation's underserved being the key word here, by uniting communities in need with caring health professionals and supporting communities' efforts to build better systems of care. So this is sort of like the teachers who go work in underserved communities and they get their student loans repaid. The same sort of thing happens for dental hygienists. So if you were to go to an area and work in public health in an area that is underserved, your area might be eligible for student loan repayment of your only eligible student loans. So those would be most likely the government loans, but I'm not 100% sure. If you're interested in something like this, then that would be something to look into. Um, and it's also, it's not just, you're getting paid at the rate that they pay, public health, but also you get loan repayment, you'd get benefits probably, and you'd really get to give back to a community that truly needs it. So the what really is that you're not just seeing patients who have insurance, who I mean they need health care, they do, but do they need it, sorry, as much as people who don't have health care? You have to think about that, like where do you want to put your effort in the world? Next up is the VA hospital. So VA hospitals, VA stands for Veterans Affairs, by the way, are created to treat the ongoing disabilities of veterans incurred during military service. So I don't know if you guys know how disability works for veterans, but basically when a service member is getting out, either they retire or they finish their contract, they're eligible for um, to apply for disability. So if at any point in their service they were hurt, and it has to be in the line of duty, then they are eligible for disability and they get a certain percentage of disability when they get out based on function. So, like if someone were to hurt their back terribly, they would get a higher percentage of disability than someone who rolled their ankle, kind of thing. But it's all based on how much that injury will affect them later in life. And typically disabilities get worse as you age. So when you get out, if you've hurt your back and you hurt your neck, and then they say, but you're still functioning, you're not in a lot of pain every day, and so that when you get out, they might say you have 50% disability. But then when you're 65, that injury, a back injury and a neck injury, would be hurting you quite terribly, and it would certainly get in the way of your daily functioning. So at that point, you would like reapply. They would, review your records, and then they might bump up your disability to a different percentage. So in order to be eligible to, as a service member, to go get treatment done at the dental clinic, you have to be 100% disabled. They're very particular about dental. Now, if at some point in the line of duty, you were hit with anything, or you had some sort of dental problem that was ongoing, they will typically cover you until your problem is solved. So, if they knocked out one of your teeth while you were in the service, they will pay to replace that tooth, right? Maybe they'll give you a little flipper or something, a partial denture, right? For a while, and then once you get out and you're kind of hanging out, you're like, you know what, I really want an implant for this tooth I lost, then you're able to go get services like that. Odds are, though, you're not getting any of your cleanings through the VA if you're not 100% disabled. So that's how that works from the veterans side of things. You don't get your care done at the VA hospital itself. There is a dental clinic that is separate from the VA. So care is delivered through, well, this is for the whole United States, 172 medical centers and 55 outpatient clinics. Dental services are located in each medical clinic and outpatient center. So here in San Antonio, it's an outpatient center. And then dental hygienists are employed as civil service employees in VA dental service clinics. So the way to work in the VA outpatient center here in San Antonio is to, excuse me, is to go to USA Jobs and apply for it, right? Um, my advice to you, if you're interested in something like this, is to understand that while, yes, it is government and it's run like so much more hands off than any other place you would get hired, I would still approach it like every other place you would want to get hired at. So you don't blind fax or blind email your resume to places, okay? Because that's not personable enough. And so what you do if you're really wanting to get a job at a place, you print out your resume, you print out your cover letter, print out your references, and you get dressed nice, right? It doesn't have to be like the attire you're going to wear for the interview, but you got to look presentable, right? And you go to the place and you say, "Hey, I'm so and so. I'm looking to learn more about the job here. I'm really interested in working here, and I'd like to kind of know more about this place and see if it's really, somewhere that I should apply for." And if you do this at an office, they're going to be like, "Oh my God," like so impressed. Like, "Oh, I'll take your resume," and sometimes you get to meet with the dentist or the office manager then right there. And sometimes they'll talk to you about maybe temping or something like that if they're not looking for someone, or they'll tell you, "Hey, we're not looking for anyone right now, but we'll keep your resume on file," right? That's how offices typically work. But if you go to the VA hospital, you're going to meet some of the people who have a hand in selecting candidates, right? So if you go, you have all your stuff, you talk to them, you're really personable, you tell them about how passionate you are about serving veterans, right? Then they're going to see your name, they're going to remember your face. I mean, they might not, it might not be perfect, but when your application comes through, they're going to be like, "Oh yeah, I remember this person. They came and talked to me." So you're a little bit more likely to make it through their screening process, as long as you're qualified to work there, than you would if you had never gone in person. I also would recommend going and talking to one of the hygienists who work there. They're probably not going to be able to like give you a tour or let you shadow because it's the government, that they don't do kinds of stuff like that. But um, if you meet a hygienist who works there, you can ask them what it's really like. I mean, that's the whole point of what we're doing right now, right? Is trying to meet people who work in these practices and get to know people and really get like the true reality of what it's like to be there. And so you might think it's all amazing working at the VA and hanging out with veterans, but there might be a darker side. So you don't know unless you go and you talk to people. It's a very face-to-face sort of place right now with COVID. I mean, it's probably a little rough with meeting people, I know, but that doesn't mean that you shouldn't still pursue a personable sort of approach to your applications. And then my next advice is every single day you check USA Jobs. Even if you apply for USA Jobs, and you have an account on their website, and you change your password every time. I'm not kidding. The password is brutal. But you still have to check it every day because the post will come up and it will fill applications quickly. Okay, so you definitely want to be within like a day or two of the post going live, and you might or may not be able to get a thing. I mean, it tells you that it'll send you a notification if a position opens, but it doesn't. So I'll be the first one to attest that that part of the website probably doesn't work that well, because I've never received a notification. I always receive a notification that my password is up, but not that there's ever a position open. And what they do at USA Jobs is they, take in everyone who's qualified for the position, and they'll send it to the next round, I guess. But then once they hire the position, they don't necessarily just chuck out everyone else's applications. They actually kind of keep them on file. And then if there's like a quick fill kind of position that they need filled quickly, then they will already have your application there. So that's kind of how it works over there. Military-based careers. This is one I don't know that much about because I haven't ever looked into it personally. But you would practice on a military branch dental clinic as a civil service employee. So again, USA Jobs, as an independent contractor or as a professional dental management employee or active duty personnel. Um, they have their own active duty personnel, especially in the Army and the Air Force here. I'm really sorry, my dog is barking, but um, they have them, but typically, as if you'll talk to Mr. Huerta, they train dental assistants to do dental hygienist functions, right? But they don't have that many active duty dental hygienists. Okay, so what they do is they'll contract to dental hygienists who are licensed, right, to do periodontal treatment, and then they'll do like coronal polishing. They train some of them to do like supragingival scaling, and to do a lot of those kinds of things. So if you're interested in a military-based career and working on the base, you might want to reach out to Mr. Horta and see what he has to say. I'll talk to him about maybe speaking to us a little bit about that. He wasn't on my original list, but this is the third time I've seen this military-based careers thing. So he might be a really interesting person to talk to about this. All right. So also keeping in that same sort of lifestyle, working for the federal prison systems. This is for the federal, like the Bureau of U.S. Bureau of Prisons, would be to provide routine and advanced prophylactic and therapeutic dental care to the inmate population. You would be responsible for planning and directing the preventive dental health program. I have a friend who works, I met her through Texas Women's, because she's also trying to get her master's degree because they have a really wonderful management system to like continue on for. So if you're interested in working for the prison system, they have wonderful career advancement opportunities. But applicants are going to have experience with expanded functions. So it's possible you guys would have to take one of the local anesthetic courses because you're probably going to do something like that. When you work on a base, any military installation, to include the prison systems, you can function based on any dental hygienist, like from any state's scope of practice, you can function in that. So if there is a state out there that allows hygienists to do something, then you are also allowed to do those kinds of things. So um, that's how it works, like when you work on a federal base. So you guys would probably need to learn local anesthetic, and you would probably have more of a diagnosing sort of role. So applicants have to have experience with those expanded functions. And then you can be hired as a civil service employee, an independent contractor. They hire from the U.S. public officers, the Public Health Service, or employees of a professional dental management firm, so like a staffing agency. The friend that I know that works in the public or in the prison system, um, I know that a lot of time the worry is that you're working with inmates, right? Like that would be pretty scary. But she said, from her experience, or sort of from my second hand through her experience, is that the inmates are very grateful that you're there, that you're providing this service to them. And then typically they are like really, really nice because they know if they do anything wrong that they're not going to get the care that that they want, you know. And so they are usually just overly grateful, more so even than working in private practice. So from what I took from what she was telling me was that they're some of the nicest people that you're going to work with because they do actually value that you're there for them and helping them. So um, if I were looking into a career like this, um, I don't think that that would have been a deterrent for me. So if you're looking at this, I don't necessarily think you should put working with inmates in the, you know, in the pros and cons. Don't put it in the cons list because I don't necessarily think it's just a con, pun intended. Working as an independent contractor, this is as dental hygienists who are in business for themselves. This is not allowed here in the state of Texas. You are not allowed to work as an independent contractor. Um, as far as providing dental hygiene services. You're not allowed to. Now, you could work as an independent contractor if you were doing like a consultant or something like that. You could work for like companies and help them build hygiene departments, kind of thing. Or you could own your own business, but it is not a place that uh, dentistry would be being done at. Not in the state of Texas. Independent contractors can provide in other states can provide clinical services, consultative services, and educational services. They're usually paid a little bit more than regular employees, but they don't get benefits. Obviously, you know, if you're working as an independent contractor, you have to pay taxes off of your income that you get, and they're not automatically pulled. So you have to fill out a different tax form, and you have to be really mindful of that because the IRS scrutinizes independent contractors much more than they look at people who work for an employer. And there are different legal tests for determining working status and classifications. So if you're interested in doing something like that, independent contracting, then I would certainly look into you know, making sure everything is legal. Working for a dental staffing agency. You guys probably will talk to Louise. She is running the temp agency, and it's sort of pretty similar to this. If any of you guys have ever worked for a staffing agency or a temp agency, they are a management firm that provide personnel. Okay, so they link people together, right? So an agency gets calls from dentist offices who say, hey, we need somebody for this, or they'll get a call from, you know, the prison system over there that says, hey, we need a person to come work for this time frame. Can you find us someone? And the staffing agency will be like, yes, right on that. And then they link up with hygienists and they're like, hey, I've got a position over here doing this for this amount of time. Will you take it? And then the hygienist will typically say yes because obviously they're working for the agency. They want a job. So they'll say yes, they'll go work there for that time frame, right? The prison system in this scenario will pay the staffing agency a rate. Typically, it's much higher than what they would typically than they would just pay a hygienist, right? Because they're paying for the agency to find and manage all of that stuff, and then the agency pays the hygienist. And so a lot of times you'll find offices when you start working in private practice, they don't want to reach out to temp agencies because it's much more expensive to pay a temp agency than it is to just find your own hygienist. So, um, the pros and cons, right? When you're working for a dental staffing agency, you may or may not have benefits. It really just depends on the negotiation you have with that agency. So be mindful of that. You know, just because you're working on the base or because you're working in a prison system or if you're working at the VA, like it doesn't necessarily mean you have all of the benefits that the people who are employed through that institution have, because you're not. You're employed through the staffing agency. They are the ones who fill out all your tax forms and submit taxes and do all of that. So you get your W-2 from them. Okay. Keeping on with that, they have they provide services for the Air Force, the Army, the Coast Guard, the Navy, and the Federal Bureau of Prisons. Okay, so the Student Dental Health Public Opportunities, we are on 299 in your book. Um, this is a public health services program. It stands for Commissioned Officer Student Training and Extern Program, and it is something that you coordinate before you start hygiene school. So if you know people who are interested in joining the PHS Commission Corps, then they pay you. You join that service, that that branch of Uniform Services, and they pay you to go to school. They pay all your school. They pay you as if you were already in. So they pay you to. They basically pay you to go to school, and then when you get out you are called to active duty for training. So you get out, and then you get your commission at the end. As far as this works, it's very hard to get into this kind of program for people because of all of the amazing benefits, but it's not impossible. This is similar to what they do for a lot of officers who are joining. People who are about to start college will say, "Hey, I'm going to join this branch of the service." One of the officers I worked for did this, and they paid for his entire bachelor's degree, and they paid him to go to school for his bachelor's degree. And then once he finished, he had a 6-year contract he needed to fulfill. So it's usually a little bit longer than your regular contracts you would sign up for. But I mean, you're a commissioned officer at that point, and so you have all of those benefits. If that's that, well, obviously you guys can't do that for this because you're already in school. But if you wanted to join in a capacity like this, they might pay for your bachelor's degree. So, I mean, it's worth looking into. The requirements for that would be 1 year of study in a medical, dental, or veterinary school, or 2 years study in an accredited bachelorette program in various areas of study. They you're expected to return to studies after the co-step participation. You have to be less than 44 years old because you have to be less than 44 years old to join PHS anyway. And then there's a junior and senior co-step program where the requirements vary. So you guys should look into that if you're interested. State opportunities. So your book talks about these just a tiny little bit about your state and your local opportunities. Um, this is basically just saying that, like, hey, go to Texas's website and see what their public health kind of things are for. But hygienists here in the state of Texas can be employed as clinicians, educators, administrators, or researchers. And then there are some states who can you can be employed with additional education as the state dental director. So it really just depends on the state. Local opportunities. So we're going to talk to Ms. Hostetter on Friday coming up, and she has a lot of really good information on some of the local public health opportunities here in San Antonio. So I'm very excited to get to learn from her about these things. But they have school-based programs, preschool varnish programs where they go around to preschools and apply fluoride varnish, and then oral cancer screenings that are done in nursing homes. There are so many more opportunities than these. They usually have a sealants school-based programs where they go around to different schools and do all of that. And so if you're interested in things like that, we're going to talk to Ms. Hostetter, and she's probably going to give us a lot more information and resources for that. International opportunities. So 25 other countries educate dental hygienists, according to the book, which was written in 2017. So therefore, there are other opportunities to go work as a dental hygienist in other countries. Miss Vaughn actually has done this, where she went to another country. I can't think for the life of me of what country she went to, but she went abroad and she worked as a dental hygienist in another country. And she said it was one of the most amazing opportunities she'd ever had. So if you guys are interested in maybe going to another country, to work, I think you should definitely look into it. It's one of those once in a lifetime opportunities. Um, and I mean, some of you, I know you have kids or you have families that kind of keep you here, which I mean, that it's understandable. That was one of the factors for me not getting into something like this. But if if you don't have those kinds of things and you're interested in going and seeing places, then this is certainly something that you could do. You just have to look them up. So, the purpose of this chapter was to expose you to the fact that there are other places that hygienists can work, specifically in public health. Especially, there are a lot of employment opportunities that have a very different lifestyle than what a clinical hygienist working in private practice would have. And so, I don't necessarily think that you shouldn't go try out clinical practice, because it's certainly a learning curve. And I think it's a great idea to go get some experience and then branch away from it. But it's up to you. It's up to what you want in life. So, now you know more about what else you can do.